Hi, I'm Rob Brantley, kinesiology student at Cal Baptist University. I'm here with my lovely assistant, Mylene Brantley. Today we're going to demonstrate a rehabilitative exercise for someone that has sustained an injury to their ulnar collateral ligament of the elbow. The exercise that we will be demonstrating today are weight shift exercises. This is good for the recovery of the elbow because it creates isometric contractions on the surrounding muscles of the joint. Strengthening those will help support the ulnar collateral ligament in its repair. It challenges that kind of like dynamic stability, moving or shifting through those different planes of motion. Execution of this, the athlete or our assistant here is going to set up in a prone position on all fours, on hands and knees. Firstly, you want to make sure that your athlete is always setting up in a neutral spine position. As you can see, she's demonstrating the neutral spine position with a flat back and that's not rounded or hyperextended. And from here, the patient that's recovering, athlete that's recovering, is going to shift their weight superiorly or forward, inferiorly backwards, laterally to both sides, left and right, and in circular fashion or circumduction of the shoulders, while all the while with the arms in extension, forcing that isometric or stabilizing contractions of the elbow. Common faults that you see with this exercise are rounded backs or hyperextension of the back where they're no longer in a neutral spine position. This can compromise the athlete's health in the spine. They could possibly injure themselves in a new area, which you want to avoid at all costs. But once they master the weight shift on all fours, the athlete can progress to a greater stimulus, which can be created with, as we're going to demonstrate, using an unstable surface. So in a similar setup in the prone position with the neutral spine, our athlete or assistant here is going to demonstrate the same superior sway, inferior sway, and then laterally to both sides, and the circular swaying motion or planes of motion that's putting those stabilizing muscles through the isometric stress. To further increase the intensity of this exercise as they progress, going from all fours into a push-up position. Again, this is important for a neutral spine position because now the core is being stimulated even more, along with the stimulus on the upper body weight shifts. So for these two exercises, both will be performed, or the progressions of them will perform about three sets of each. It's going to be 3 to 4 reps in each plane of motion. So it's performed in a complex. So go 3 superior sways, 3 inferior, 3 lateral, lateral to the other side, and in the circular fashion, totaling about 15 to 20 repetitions for one set. Perform this around 3 to 4 times per week, allowing adequate rest or days for rest and recovery. And the supporting muscles will help aid the recovery of that ulnar collateral ligament and the elbow joint. Thank you very much, Mylene, for the wonderful demonstration, and thank you.